Good morning, Abhishek. It is Tuesday. It's been a crazy weekend. We had lots of snow, first snow of this season in Boston, and I hope to have more of this snow. It's been cold, but it's also been fun. It's a bit more than just cloudy skies and rainy days. It's just sunny day with a bit of snow around here. So yeah. But I actually wanted to talk a bit more about what you said in the last video as well, and I had a couple of thoughts of my own, regarding COVID. So I completely understand where you're coming from. It's getting scarier again with yet another, you know, a variant of COVID. We had the original, the OG, and the Delta, and then the Omicron. I know I shouldn't be laughing about it because it's a really serious disease that's affecting not just people themselves but also people around them, and it's a really horrible thing that's been happening. But I think it's kind of a it's going in the direction at least a bit more favorable to humans than it used to be, because as you stated as well that uh, we have a lot more cases this time around, but we still don't have as many hospitalizations or deaths. So it's still kind of better for us to be facing this new variant where it's not as much effective. And again, as you said, it's also maybe kind of connected with the fact that a lot more people are vaccinated now. So even if they are getting affected, it's not causing them a lot of symptoms, and if it is, then it's not very severe. I had a couple of my own friends who I almost regularly meet. Every day I meet them, and one of them contracted COVID just after getting the booster shot. One of them got it right after we finished our New Year's week of parties, and it got a bit scary because we were all hanging out together, and I think it was in a group of, I think, around 15 or 20 of us that used to hang out a bit regularly for those 2 weeks. I think we had two or three people uh, who got infected, and the same thing was that nobody got really affected with the symptoms. Most of them didn't have symptoms at all, and some of them had really mild symptoms, and it didn't affect their life a lot. So I'm definitely grateful for that. And I think it's also kind of in this coming back to the point of deaths and hospitalizations. I think it's a lot to do with the fact that it's still the wave is still just beginning, even though we would like for to think that we're reaching the peak. The numbers don't lie. We're still nowhere near the peak. It's just increasing exponentially, the new daily new cases. And I think the number of hospitalizations and deaths is gonna just keep increasing as it goes. But let's hope it doesn't go out of hand. So an interesting idea that I had regarding this as well was that I think Omicron is the Omicron variant, and how it got mutated into it. How COVID got mutated into this is kind of how kind of how you would reason around the entire evolution and mutation of the virus as well, and that art of reasoning that we talked about before in the Vsauce video. But I think I have a very very uh, opinionated reason, at least, behind how the Omicron is and why it is this way. I guess it makes sense that Omicron turned out the way it did and the wave is working out the way it is, because on top of on top of everyone being vaccinated, it still is a bit surprising that a lot of cases are going as asymptomatic. I think we had a total of four or five people that I knew that contracted COVID within a span of like 10-14 days, and only one of them had like real symptoms. Everyone else was like maybe fever for a day or not even that, right? So I think the reason behind that is that just really simple, that the variant that is easily spread out is the one that doesn't give you any symptoms, because then you're much less likely to think that you have COVID, and then you can spread it more easily. So I think it's just a kind of artificial selection but natural selection, kind of a bit of both at play here, and it's just easier for the Omicron variant to spread and mutate into what it is right now. That it spreads really easily because it's really difficult to detect it on an individual level, and you can really easily spread it. And that's also kind of why when a lot of my friends got COVID, it was, I mean, of course, I was not going out anyway. It was I was working most of the time, and then I wanted to rest after a week of parties. But then uh, the fact that a lot of my friends got COVID just panicked me a bit, and I decided to get a kit for myself, a home testing kit, and I tested myself, but it did turn out to be negative. It didn't, uh, you know, it wasn't a positive report, so that's fine. But even though Mun had a negative report, and he lives with me, so I was less concerned about me being positive. But because this thought stuck in my head that if there are a lot of chances of you being asymptomatic and still positive, uh, it just never left my head, and I just kept thinking about it, and just to get it clear out of my head, I had to get that test done. So it was still an antigen test. Of course, it's not a PCR test. It's a home testing, a simple antigen test, and you get results within 10 minutes, and it was a negative. So it's of course not the most accurate one, but it still has a 90% accuracy. And yeah, we've had entire discussions about how uh, accuracy of tests are really misjudged, and how you should really think about tests and the whole Bayesian theorem and everything. That's not something that I want to discuss here in more detail than we already have. But yeah, those are my 2 cents on the variant, and how it is gonna be this next wave of uh, infections not being very symptomatic. And I think the two major reasons for this are, first, that we are, as I said, vaccinated. A lot of us are vaccinated now, and also this fact that the Omicron variant is naturally selected to be a variant where you don't get a lot of symptoms, unless you do. I mean, if you have some kind of comorbidities, or you just weak against the virus, only then will you exhibit symptoms. And yeah, hopefully you don't. It's just statistically unlikely that you won't, but you still can. Yeah, I'm kind of planning to put this video out public as well. But yeah, it's been a long time since I recorded a video for which I cut multiple times. This I think there'll be a lot more. I think there are a couple of cuts that'll be in the video, and there's yeah. I hope I can come back to uh, the single shot recording that I have been doing for the past, I think, what, a month now. Yeah, that was fun. It's sad that I'll have to cut a lot of it, but yeah. Let me know what you think. I know COVID is the disaster that it is for this entire decade. I feel like between 2020 and 2021 and 2022 doesn't look to be improving a lot, but there is a silver lining. That at least now there are a lot more cases that are asymptomatic, and I mean, of course there's reason to worry because it is asymptomatic and you won't know it's there, but it also is a sign that whatever we are doing to fight it is kind of working, because we're reducing actual human effect on the through the virus. The virus is not as severely affecting human lives as it used to. And I hope that we can kind of mellow down this dread of number of cases. This the I think starting May and June 2020, we've always been thinking about the number of cases, a number of deaths, a number of this, a number of that, you know. And I think it's I guess a bit realistic to be hopeful about the fact that we can be a bit more uh, you know relaxed about the number of cases, because yeah, it doesn't seem that it will be that severe, at least to an individual human, you know. And if human suffering is reduced for this wave as opposed to the other waves that we've had, I think we did kind of fight the virus pretty well. And yeah, we'll keep fighting. All right, yeah, that's pretty much it, you know. Let's see what you think, and I'll see you on Friday.